Hello friends, good morning. In this session, we will discuss the next set of questions. The last to rise in last enzyme to rise in myocardial infarction is lactate dehydrogenase, and Duke criteria is used for infective endocarditis. The next extradural hemorrhage. So extradural hemorrhage, it will be having a lucid interval. That is after the injury, the patient will be having a normal consciousness. Then after some time the consciousness will deteriorate. It is due to rupture of the middle meningeal artery. In CT scan you can see biconvex or a lenticular hyperdensity. Then clinical findings, there will be like a mid dilated pupil on the affected side, so that is a Hutchinson pupil. Then treatment will be immediate burhole surgery. Then in a CT scan, concave convex hypotenuse lesion is in a CT scan is seen in a subdural hemorrhage. Then next we will see about the Broca's area. So Broca's area, it is a speech center located in the inferior frontal gyrus. It is supplied by the superior division of the left middle cerebral artery, responsible for expression, grammar, logic of speech. So damage to this area will result in Broca's aphasia, characterized by they can understand the speech but not able to express. That is a fluency loss. Then next is the Wernicke's area. So Wernicke's area is situated in the superior temporal gyrus. It is supplied by the inferior division of the left middle cerebral artery. So the patient not able to understand but able to express. That is a fluency is preserved. The most common site for a hemorrhagic stroke is putamen. Drug of choice for subarachnoid hemorrhage is nimodipine. So artery of a stroke is a lenticulostriate artery. Lenticulostriate artery is the branch of a middle cerebral artery. So blood in the sylvian fissure is a diagnostic of a subarachnoid hemorrhage. Subdural hemorrhage is due to rupture of cortical bridging veins. Lippmann-Sachs endocarditis is seen in a systemic lupus erythematosus. So next we will see about intracranial pressure. Normal intracranial pressure is about 10 to 20 mm mercury. If it is more than 20 mm mercury, it is an increased intracranial pressure. Treatment is via IV mannitol. Cushing reflex is seen in an increased intracranial pressure. What is Cushing reflex? There is a bradycardia, increased BP, and irregular breathing. So this is a Cushing's reflex. Then a Jones criteria for rheumatic fever. There is a major and minor criteria. In major criteria, there will be like a carditis, arthritis, Sydenham chorea, subcutaneous nodules, erythema marginatum. In minor criteria, there will be like increased total leukocyte count, ESR, increased CRP, and prolonged PR interval. Then most common tumor. Next we will see about the most common tumor is most common brain tumor is metastasis from other organs. Most commonly the Wurzel carcinoma of the lungs, and it is most commonly metastasized to parietal and the temporal lobe. Most common benign tumor of the brain is meningioma. Most common malignant tumor in the brain is glioma, that is astrocytoma. So most worst prognosis is glioblastoma multiforme. And blood-brain barrier is formed by food process of astrocytoma. So the blood-brain barrier is formed by food process of astrocytoma. Okay, Cushing ulcer is a type of ulcer in stomach due to increased intracranial pressure. Then a curling ulcer is seen in burns. Then Cameroon ulcer is seen in hiatus hernia. Okay, brain death. What is a brain death? So brain death means the cortex is working. That is, spontaneous finger movements are present. Spinal cord is functioning. Toe movement plus we can elicit deep tendon reflex. But the brain stem is dead. The brain stem is the center of cardiovascular system and respiration. It is dead. So how we will diagnose? That is by a light reflex. The light reflex is mediated by cranial nerve 2 and 3, or a pupillary reflex is absent. That is bilaterally they will be having fixed pupils, non-reactive to light. Then corneal reflex. That is carried out by cranial nerve 5 and 7. It is also absent. That is blinking is absent. Gag reflex. Gag reflex is carried out by cranial nerve 9 and 10. That is absent of stimulation of the posterior pharyngeal wall. That is, a cough is absent on stimulation of the posterior pharyngeal wall. Then a caloric stimulation test. On installation of the cold water in the external auditory canal, the eyeball will be moving to the opposite side. For warm water, the eyeball will be moving to the same side. Then oculocephalic reflex or a Dahl's reflex is absent. Disconnect from the ventilator, there is no spontaneous breathing effect. EEG shows a flat isoelectric line. MRA, that is magnetic resonance angiography, it will be showing no blood flow in the brainstem. So minimum 2 doctors should certify the brain death. Minimum 8 lives can be saved. Then organ preservation solution is the University of Wisconsin solution. Okay, for a short-term memory, it is stored in a hippocampus. Long-term memory is stored in neocortex. So next we will see about the function of the dominant parietal lobe. The function of dominant parietal lobe is responsible for maths. So if it gets damaged, it leads to acalculia. And also next function is a logic. So loss of logic leads to alexia. Then next function is understanding the written test. So damage due to this will lead to agraphia. Then right to left orientation, and also the next function is a speech. So the loss of speech will lead to aphasia. So the non-dominant parietal lobe is responsible for visuospatial skills. Damage of this leads to apraxia. The temporal lobe damage will lead to complex hallucination, deja vu, jamayu. Then frontal lobe damage. So the frontal lobe damage will lead to aggressive antisocial behavior, urge incontinence, apathy, that is a lack of a sense of well-being, magnetic gait. Then abulia, that is a lack of interest in speaking. Then occipital lobe damage will lead to visual hallucination, homonymous hemianopia, palinopsia, that is persistent of image even after the object is removed from the field of vision. Then simultognosia, there is no simultaneous processing of the two objects in the brain. Next is gun barrel vision. So gun barrel vision is seen in a bilateral posterior cerebral artery infarct. Then tunnel vision. Tunnel vision is seen in retinitis pigmentosa. Tunnel vision is seen in retinitis pigmentosa. Then middle cerebral artery does not form the circle of Willis. This we have to remember. Then spina bifida occulta. Spina bifida occulta. The antenatal diagnosis is a frog eye sign in the ultrasonography at 10 weeks of gestation. Then amniotic fluid acetylcholinesterase is increased. Then maternal serum alpha fetoprotein is increased. Okay, in antenatal ultrasound, if lemon eye sign, and banana sign is suggestive of Arnold Chiari malformation. Then a starry sky appearance in the MRA is suggestive of neurocysticercosis. So the drug of choices. Drug of choice for generalized tonic-clonic seizure, absent seizure, and myoclonic seizure. For all these things, sodium valproate. Drug of choice for absence seizures less than 4 years of age, it is ethosuximide. And also drug of choice for focal seizure is oxcarbazepine lamotrigine. Then tuberous sclerosis. The tuberous sclerosis is a neurocutaneous autosome. Neurocutaneous, this is autosomal dominant. The manifestations are very important. Ash leaf macule, that is a hypopigmented macule on the trunk. Then a chagrin patch, that is orange skin patch. And there is adenoma sebaceum, then a coinin tumor, there is a subungual fibroma over the finger tips. Then a Dawson finger appearance in the MRI is seen in multiple sclerosis. Okay, next we will see about neurofibromatosis. In neurofibromatosis type 1, it is autosomal dominant. It will be like cafe owlite macules, axillary freckling, pulsating proptosis, Lish nodules, that is iris hamartoma, then optic glioma. Then a neurofibroma type 2 acoustic neuroma is present. Okay, then next about Parkinsonism. Lewy bodies, that is alpha synuclein protein is seen in Parkinsonism. Then Hirona bodies, that is a tau protein is seen in Alzheimer's disease. Then a tensilon test, it is used to diagnose the myasthenia gravis. Then a Duchenne muscular dystrophy is a X-linked recessive disease, proximal muscle weakness. It leads to waddling gait, and also you can see Gower sign. Then the next about mental retardation. If IQ is less than 70, it is mental retardation. Mild mental retardation is 50 to 70. Moderate mental retardation is 35 to 50. Severe mental retardation is less than 35. Okay, then next knee jerk reflex. So knee jerk reflex is present in a conus medullary syndrome. and it is absent in cauda equina syndrome. Okay. So knee jerk is present in conus medullare, but this is the way to differentiate. Okay, next we will see in the next video. Thank you very much. Bye.